I'm just going to start by introducing myself. I am Natalie Gonzales. I'm a physician here in town. I've actually been here in Helena since 2003. I used to be a general surgeon in town. And I worked at St. Peter's to do my surgery, and then I worked at the VA for a while. And then I went back and decided, first of all, that I was going to retire from surgery, but I went back to do an additional probably 6 to 8 years of training. And I trained in Integrative and Functional Medicine, and this is one of my, brain health in general is one of my really strong focuses. And as we go through the program a little bit, I'll explain a little bit more about why that is. But so neuroplasticity, fascinating subject, and I'll try to give you a sense of why I think that and what the potential is for us. And so the way the program will run is I'll first just give you some background about what that is, a little bit of a definition and background. Then we'll go into some of the examples of it and places that it can be used today in so many different ways. And in so many different people, all of us. And then the last part of the presentation will just be a little bit about how that looks for you every day, and what you can do every day in your life that will use this to its full potential. So that's what this program is about. All right, so I'm just going to do my disclaimers first. I just told you who I was. One of the other things I want to mention is that I also am certified in ReCODE 2.0, which is a program that Dr. Dale Bredesen developed. And it's a protocol for being able to slow and reverse Alzheimer's and dementia. So that's really what his program is about, and that's one of the certifications that I have. But I also want to mention that there's somebody else in town who does a similar type program, and that's Dr. David Kraniker. He's one of the people that I'm actually collaborating with, one of my colleagues, and he does lifestyle medicine, and he uses the program out of Loma Linda that was developed by Dean and Aisha Sherzai. And it is very similar to Dr. Bredesen's program. It's using a whole different array of lifestyle interventions to actually show reversal of Alzheimer's and dementia. And it's a fascinating program. So these are two very separate programs, and they're finding the same results. Really good. So the disclaimer is I'm not going to provide any medical advice during this talk. I'm not going to have this is for educational purposes only, so don't discontinue any medications or change what you're doing without talking with your primary care practitioner. I have a private practice here in Helena in Integrative and Functional Medicine. I'm not affiliated with any hospital or clinic. My own practice is called Synergy Health and Wellness, PLLC. So those are the disclaimers. So this idea of neuroplasticity evolves around the idea that the brain can make new brain cells. And it can also make new connections between old cells and new cells. And it does this in response to experience and challenges. And there are different things that you can do to increase this process and make it more likely that you're going to make new brain cells. Now that sounds pretty standard to us today because we've heard a lot about it. In fact, I think the general public knows more about it than the medical profession because the general public shares this information and the medical profession usually puts a halt on it and says, well, there's no real research trial that shows this. So I really think that the general public, in this case, is often more informed than what the medical profession is. But for a long time, this was a concept that only recently, after the late 90s, did it really start to take hold even in the medical field. But there are still some holes in our understanding, and there's still lots of roadblocks in the field of medicine when it comes to neuroplasticity and the use of it for patients and the population in general. So I'm going to give you a little bit of background about what this means. So if we have the ability to make new connections, first of all, we have 86 billion neurons in our brain, and the potential for connections between all those neurons is 126 trillion different connections. And it is the connections that give us our memory. It is the connections and the patterns that give us our ability to do different things. And the more connections you form, the more resilient your brain is. And that's what we're going to talk about throughout this program. So this is just a photograph, and this is actually not a photograph. This is actually just a depiction of two neurons, and the dendrites are the arms that reach out to each other. And they don't actually touch, because in between their two tentacles, there's a space in which we pass chemicals and we pass electrical currents across that space. So these dendrites, their connection is not physical, it's more they're communicating. In fact, that is the language of the brain, is to communicate through chemicals and electrical impulses. So it's not just this one brain part that communicates with this one brain part. It's not simple at all. It's a whole set of patterns that make up a memory or a skill. So let's go on to, I like this analogy, and this was Dr. Kraneker's analogy, and I really love it. I think it's a really good one. And it's the idea that the brain cell, which would be in the middle of this spider web, the brain cell is much more vibrant and alive the more it is connected to other brain cells. And that's why in this process of neuroplasticity, growing the brain, it involves making these connections between brain cells, because it makes them healthier. And if a brain cell does not have good connections, or it starts to lose the connections, maybe the spider web starts to fall apart, the more of those connections it loses, the less it is being used, the more likely that cell is to die off. Okay? So that's a wonderful analogy, is just the idea of the spider web. So when it comes to the idea of neuroplasticity, this man, Moshe Feldenkrais, is a Jewish immigrant who actually he worked in Madame Curie's lab. Madame Curie, the one who developed radiation. It wasn't the lab she was in, because she had passed away by that time, but he worked in the lab of her daughter and son-in-law when they were developing uranium in Paris just before the Nazis came in and took over. And he got out with, they helped him get out with a visa and 2 suitcases of uranium, one of which he ended up losing along the way. But anyway, he went on to work for England to develop the sonar at that time. But one of the things he did also, he was a physicist, and he studied judo, and he studied the way the body worked in relation to what was comfortable and in relation to physics. And he developed a technique pretty early on in which he communicated with the brain through the body. So he took people who had obvious brain injuries, brain trauma from just head trauma, but also brain injuries like stroke, cerebral palsy, young children who had really a difficult birth and maybe low oxygen during birth, and their brain was functioning very poorly. Or in one case, it was a young child who had only part of her brain. She was missing a large part of her brain. And he interacted with the brain through the body. By knowing what body parts were working, it would tell him where the brain problem was. And he could interact with the healthy areas of the brain by using the body and the body movement. It was absolutely fascinating what he could do at a time when he had no access to electron microscopes and he had no access to brain scans. Incredible work. The man was brilliant, and he did some brilliant work with some of these people. This child was the child who had a portion of her brain missing. Her parents were told that she needed to be institutionalized. She would not walk, she would not talk. At the time he saw her, I think she was 13 months old, she couldn't do anything. She couldn't roll over, and she just cried constantly. She was in constant pain. And he worked with her very gently, just feeling what was working in the brain and what wasn't. And her parents said, "Do you think she'll ever be able to do anything?" And he told them, he turned to them, and he said, she will dance, actually. She will dance at her wedding. And they followed him around for years. He traveled all over the world, and they followed him so that she could work with him throughout her lifetime until she was older. And she eventually got 2 degrees. She went to college, she got 2 degrees. One was social work because she needed something practical, and I think the other one might have been philosophy. Anyway, she ended up getting married and having 2 children, and she did dance at her wedding. It was amazing. So I'm going to give credit to a lot of people here who went undiscovered because their work was so different, and they were really on the outskirts of this thought process. This is Marian Diamond. She is known for, she's a neuroscientist, and she is known for the study of Einstein's brain. But early on, in the 1960s, I think around 1965, she did some work with mice, and she had 2 groups of mice, and she put one group in what she called an enriched environment, and the other group in a non-enriched environment. So the non-enriched, they had food and water in a cage, and really not a whole lot else. And the other group, they had toys to interact with and things to run on, and the cage was very, lots of things to play on, and they had, their mice mates with them. And anyway, at the end of the study, they euthanized the mice, and what they found was that the mice in the enriched environment had much larger brains, and the mice that had a non-enriched environment had, more atrophic or small brains. So they did the experiment again, and the same thing. They found the exact same thing. So it wasn't a fluke. So she gave a presentation to the neuroscientist group of the time, and there was a man who stood up in the back and said, "Young lady, these brains do not grow." And she said, "Well, I'm sorry, but my research showed that it did. These brains grew, and in fact, the repeat study showed the same thing." Well, they ignored her work for at least 2 decades, So it wasn't until probably the 1990s, late 1990s again, that neuroplasticity started to take hold. I'm going to talk about some facts and limiting beliefs because they really are limiting, and I think they have limited our society in the United States as a whole. When the idea was to get to age 60, retire, rest, do very little, and then you pass away, okay? And And this has really, luckily, started to change so that people who may be not doing the same thing they did throughout their first 60 years are starting to take on another career or to expand on the career that they had, but they're starting to think, no, I don't need to just stop here. It's not time to stop. And so we're seeing quite a transition here, but this idea that the brain does not grow, I grew up with it. I know that when I was young, I was taught, if you don't learn a language by the time you reach puberty, you are really not going to be able to learn a second language. And so you had to do it before you reached puberty or else, you know. And we know that's not true now. Lots of people study languages later. They don't have to study them. And I'm not saying that it's not harder, because I think it is harder. And we'll talk about that a little bit also. The second myth I remember, this is a really strong one too, that if you haven't learned to play an instrument by the time you finish adolescence, that's not something you're going to be able to do later in life. And when I was in my 20s, I worked with a cardiovascular surgeon, Dr. Forster, and on his 50th birthday, he decided to take up the cello. And he bought himself a cello, and he had lessons, which he hardly ever made it to because he was always late for them, and the teacher would say, well, you have 5 minutes, and then your lesson is done. And so even then, he was mostly self-taught, and I heard him play 6 months later, and it was phenomenal. It was so beautiful, and they invited him to play in the orchestra because he was so good. At the age of 50, taking up the cello. Turned my whole world around when it came to the myth that you couldn't learn an instrument if you hadn't done it as a child. I'll give you another example of that in a few minutes. So this is also something I see every day repeated thousands of times in the medical profession. This idea that this is normal brain atrophy, that it is normal for the brain to shrink as we get older. I don't believe it's normal. I think it's what's happening out there, but I don't think it's normal. And when the radiologist reads the X-ray of the brain, and I'll explain here what's going on. On the right, the white and gray areas are brain tissue, and the black areas are fluid. And when you get to the one on the, you can tell the medical profession has to reverse right and left. So the one on the right is the one where we have more fluid. This is fluid, more fluid around, and less brain tissue because it's contracted or shrunken. We call it atrophic. So when we get the report, it will say normal atrophy of aging. That's what the report says every time it sees that. Because we assume everybody's brain has to shrink. That's part of the process of getting older. And that is absolutely not true. The studies now on brain plasticity or neuroplasticity, and all of the studies that are being done right now that show people interacting with their brain, even over a weekend time period of doing a meditation process, changes the brain. You can measure certain areas that get smaller because they're not being used during that meditation, and other areas that are enlarging because they are being used more during the meditation. Even through a weekend, you can see a change. Those two dendrites, those two arms of the neuron that go to connect, an electron microscope series of photos that I saw recently, and If it had shown up well, I would have put it up here for you, but I couldn't get it to show up well. But it shows the two brain cells and the two arms reaching out. And I watched in each set of photographs as the arms came closer together. And my impression was, wow, that must take a couple months to do that. It took 12 seconds. 12 seconds for your brain to make a new connection. Can you imagine how many new connections you're making in the course of this short talk that I'm giving? Absolutely incredible. So when it comes to training your brain, yes, it requires a lot of different things. It requires sometimes a little bit of personing. It requires some intention. It requires absolute persistence, repetition, lots of things. So we'll go through some of that too as we go along. But the possibilities are endless. I can't even imagine 126 trillion new connections or different connections. Even that number is almost beyond my ability to picture. So some of the possibilities that we're going to talk about here are talking about rewiring things. So you can have connections in your brain that are not working for you, for your best interest. And then you can have connections that are much more useful to you and healthier. And if you have the ones that are not working for you, the key is to kind of let those go by the wayside. So essentially let them unravel while you develop a new process. That's part of what we are going to talk about with this rewiring. This is Dr. Bakirita, another one I want to give some credit to. He did his work, his early work in the 1960s also, around 1969. And he was a pioneer of neuroplasticity. In fact, he was the one whose original work, when he tried to get it published, put the word plasticity on there, okay? And he could not get his work published because of that. Because of this title that said neuroplasticity. And there was a Nobel Prize winner at the time who thought his work was absolutely incredible and said to him, if you would just take that plasticity word off there, you could get it published. And obviously he never did because it's stuck with us now. Okay, this idea of neuroplasticity or malleability of the brain. So anyway, his first work was in sensory substitution, showing that the brain did not require necessarily the input from the eyes or the input from, in his case, he was studying the input from the balance centers in the inner ear. So this was another reason he couldn't get published and wasn't taken seriously. This looks like something out of a science fiction, science fiction film. It involves a camera, which is huge, over on the right side here. It involves the chair with the sensory apparatus on the back, which would be up against the person's back who's sitting in the chair, and the computer to translate everything. And what it did was, it was a black and white camera. The people he was using for the research project were people who were blind from birth. And what he did was he used the sensation on their back to be translated through the brain and tell them what they were seeing in front of them in black and white. He was using only black and white at the time. So these sensory, I don't know what they were called on the back, but the sensory stimulators on the person's back would give them a picture like what you see on the right side there, and then they could tell whether it was a face or a camera. They got to the point where they could even tell if something was coming at them, and they would put their hand up over their face to protect themselves. So these were people who had never seen anything before. So it was a rudimentary type of sight. The sensation from their back went to the brain, was converted to the language of the brain, which is chemical and electrical, and the brain said, wow, this is what's there in front of me, and interpreted it that way. He did the same thing in a woman who, let me see if I have this next. Oh, here it is. This is a woman who came to him. She was called a wobbler. She had a completely dysfunctional balance center in her inner ears. She had taken a medication that damaged the balance in her inner ears, and she was completely disabled because she would just tip over. Everything she tried to do, she couldn't balance. And she was mostly lying on her back all the time. She couldn't do anything. And what he did was he developed this device, which is the headgear, that had a device which went on her tongue. And when she tipped her head forward, when she was wearing the headgear, and she tipped her head forward, the front of her tongue would tingle with the device set on her tongue. The tongue device was about the size of a stick of gum. And then the device on the back, when she tipped her head back, it would tickle the back of her tongue, and the left side and the right side, depending on where she was orienting her head in space. And by wearing it, within a few minutes, she could balance, because she quickly learned, her brain learned, to translate the sensation to the language of the brain again and tell her whether she was too far forward or backward or side to side. Then they realized by wearing it, if she wore it long enough, within, say she wore it a minute and a half, it would last afterwards. So there was a delayed or an extended effect of it. And they found that the longer she wore it, the more, in fact, it wasn't just you wear it 1 minute and you extend the time that it works for your brain another minute. It got longer and longer, to the point that she could wear it maybe 3 times a day for a little while, and the entire rest of her day she could function normally, even to the point of being able to dance. She had really, really good balance. It just turned her life around. And they went on to develop, well, first of all, they took Dr. Bakirita's original apparatus that I showed you and made it so that for the sight, it was also the size of a stick of gum. Instead of this huge device on their back, the stick of gum would have all the sensory stimuli, and it could give them vision just from a type of rudimentary vision, just from the sensation on the tongue. And then their camera is embedded now in the edge of a pair of glasses. So yeah, a lot of engineering to take that device and make it so that it was useful for the general population. And those devices are out there. He passed away, I think, in around 2006. He passed away early from cancer, but his company is still out there, manufacturing those devices. So really, really good work early on. So I'm going to kind of go a little further here. This is, we're going to start to talk about some of the applications today for some neuroplasticity. And this is Dr. Moskowitz. And he works in California. He has a practice. It's for chronic pain. Originally in his practice, the only thing he had to use for chronic pain for people were narcotics. And he would give narcotics, every month they would come back and get their supply of narcotics for the month and try to get people so that they could function with their chronic pain. Well, he himself had problems with chronic pain, and that's really where he started his work, was to develop a program for chronic pain that would work for himself. And what he decided was, in the brain, he knew where the pain was being the pain signals were originating. And he knew that he was in a cycle, that when he first had the pain, that was legitimate, but then the body and the brain got into this cycle that would not stop. And the cycle would just, tell him that there was still pain, still pain, still pain. And he wanted to undo that cycle. And what he recognized was that the brain could only do one thing with that part. That part of the brain could only do one thing at a time. And so he knew that that part of the brain could do other things besides this cycle that was going on. Sometimes it was a brain part that was involved in memory. Sometimes it would be involved in vision, hearing, some kind of sensation, visualization, all kinds of things that could be done that weren't being done by those areas of the brain because they were too busy with this being stuck in this rut of this pain cycle. And so he developed a way to use that portion of the brain and do something else with it to interrupt that pain cycle. Now we see this, even back as far back when I was having my daughter, this would have been in the 80s, and she, before I had her, I went to the childbirth classes, and they did a demonstration of this with our partner. I can't remember exactly, I think we were just holding hands or something, and the partner was supposed to squeeze your hand until it was painful. And then they did the same thing while we were doing the breathing. So we were focused on the breathing that you do during childbirth, and we felt nothing when they went to squeeze our hand. And it was a very dramatic demonstration of how your brain can only do one thing at a time when it comes to certain areas. And that's how Dr. Moskowitz developed his program for chronic pain. Now, this was not an easy program. It took probably 6 months minimum for most people to be able to get to the point where they could stop some of their pain medications. And they knew they had no more pain, so they were just gradually going off of them. And that happened for himself. And initially, it doesn't do anything. In fact, a lot of people will get discouraged and stop doing it. But the more you do it, the more there are these brief periods where you realize, wow, I don't have that pain. And that's your motivation to continue doing it, because the more you do it after that, each time you solidify the new pathway that portion of your brain is going to use, and it's not going to fall back into the pain pathway. So it's really just reprogramming, but it takes a lot of persistence, a lot of repetition. It takes some work. I'm going to go on to, so that was just the chronic pain, and this is just going over that these areas, maybe imagination is what you're going to use during that chronic pain cycle, or maybe there's some type of humor that you need to bring up during that chronic pain. And what you do is each opportunity, each time you feel the pain becomes an opportunity to try it. That's really when you start to see some change with it. I know I did this with headaches a few years ago. I don't get headaches very often, but I did the same thing, and I had not heard of this. I just knew that when I was getting a pretty severe headache, that I could do a meditation and I wouldn't have it at the end of the meditation. And so after that, I don't think I've ever taken another Tylenol or ibuprofen for a headache because of that, because it works so well. So we're going to talk about reprogramming emotions for a minute. And reprogramming emotions is, in my own practice, I would say every one of the patients I see has some of this going on in which they could really use this reprogramming for emotions. And it's because we're talking about the limbic system. We're talking about the system in our brain which is for fight, flight, or freeze. It's a defense system. It's actually a beautifully designed system. It's to protect us. It's so well designed that we do it too much. We get into this cycle where that's our reaction. That's our reaction, you know? And so when we talk about reprogramming the brain, what we're talking about also is when that reaction goes on in the brain, it stimulates the vagus nerve, which starts at the base of the brain in the same area. And the vagus nerve, another beautiful design, goes down through the entire body, and it innervates, probably everything in the head and neck region, but it innervates the thyroid, it innervates the heart and your breathing, it innervates your gut, your intestinal tract, your adrenals, your kidneys, your bladder, and it tells all those organs, defense, defense, danger, Will Robinson. It tells all those organs to be in this state of defense. So if you're firing that over and over, every one of those organs are always in the state of fight, flight, or freeze, instead of being in the state of relaxation and restore, rest and restore. So that's why when I see patients, I can tell by what's going on in each of those organs that we have this process in the brain signaling it for each of those organs. And we need to start, often, we need to start there. So again, the rewiring program for this is a program where you first recognize that's happening, and you develop a program, usually very personal, even if in the designed programs, you still have to make it work for you and the wording work for you. But the more you visualize and put your senses into it and even emotions into it, the more you develop the new pathway of responding to things around you. And that's when you start to see things like fibromyalgia, chronic pain, chronic fatigue, PTSD, depression, anxiety. It's all of those things. It was originally, one of the original programs rather, was developed by Annie Hopper. And she, I believe, yes, Annie Hopper is in this slide. She developed something called the neuro retraining, dynamic neural retraining program, DNRS. Anyway, she developed this program, and in this program, she did it for herself first because she was having multiple chemical sensitivities. So she was highly sensitive to any fragrance, any chemical smell, and then she became sensitive to everything, foods and everything, to the point that she was completely disabled. She couldn't have patients anymore. She was a counselor. She couldn't function around her family. She couldn't function in her home because she could sense electrical activity that bothered her. So she was completely disabled from her condition before she developed this program. And it's a very, very effective program that's worked for thousands of people. There are other programs similar out there. I like this one because it's online and it's accessible to a lot of people, but there are many other programs. And Gupta is another, I think it's called Gupta program, is another one that sometimes would work for other people. So, but that's what her program is about. Again, it takes minimum of 6 months. It takes thousands of repetitions once you design your program that you're going to use. It takes thousands of repetitions, so that's why she's saying minimum of 6 months before you can see that you have changed it in a more permanent way, although most people, I believe, will see early changes in the program, even in the first few weeks. The other one that does work with emotions is Dawson Church. He has a book called Bliss Brain, and it's really about the neuroscience of remodeling your brain. So it's about neuroplasticity. And what he did research on was the use of meditation for flooding your brain with the neurochemicals that you need that just make you feel more functional, and it just has a very resting effect on your entire system. And they studied meditation, and they studied who was, not who, but what chemicals were being produced by the brain during the meditation. They studied how long it took, and they also studied, you know, just with the brain scans, what they were seeing in terms of areas of the brain that became smaller, like the amygdala, which is for the fight, flight, and freeze, and the other areas that became larger during these meditations. So, but fascinating, they studied probably the main brain chemicals that are produced during meditation, which are going to be things like beta endorphins. Anandamide is a bliss, it makes you feel very blissful. Serotonin makes you feel peaceful. Oxytocin is the connection hormone between people, and you know, they call it the hug hormone. But all of these different hormones are being produced during a meditation. And in this specific meditation that he used, it actually is a visualization meditation that lasts about 16 minutes, and it's free on the internet. And you can do it. Each part of the meditation, though, was designed to release a particular brain chemical. And then the meditation itself, it's releasing them in a very balanced way. And it's just a beautiful meditation to do. So if you're not a meditator, like I say, it's a guided meditation. So it kind of guides you along. So I know some days when I do it, I get to the end and I say, whoa, I don't think I did anything for that. And then other days I'm focused and I go right through it just the way he says. So, but it is good for non-meditators. So this is yes?
Do you have an easy way we can find that meditation?
I will make sure you have resources for all of this afterwards, yeah.
Thank you.
This is a story about a father. He was a researcher, and he asked his engineer friend to redesign his bicycle so that the steering wheel was offset about an inch. So I don't know if they put it back or forward, but what really happened was afterwards, when you turned to the right, the wheel went left. And when you turned the handlebars to the left, the wheel went right. So they said, you know, see if you can ride this bike. And he tried, and of course he couldn't, because his brain was set up to ride a bicycle the usual way. And it knew how to do this. And so he practiced trying to balance on this bicycle, and it took him 8 months of daily practice to learn how to ride this bicycle, which was designed differently, to learn how to balance on it. 8 months. And they did the same with his son. He had just learned how to ride his bike, and they offset his handlebar, and then he was really shaky again, and he couldn't ride it. It took him 2 weeks. That is the difference. That is the difference between how many repetitions it takes to undo something that's so embedded in your brain and develop a new way. And he did, after the 8 months, he was able to go back with the old bicycle. He couldn't ride it again, so he had to relearn that, but it didn't take him too long. And he started to be able to actually go back and forth between the two bicycles easier, but much harder. And I really want to emphasize that. It took this man 8 months and his son 2 weeks. That's a difference in a young and older brain. It's a difference between embedded and not so embedded brain function. John Pepper, I want to give him some credit also. He actually was the one who took Parkinson's. He was from South Africa. He took Parkinson's. He had it from the age of 38, and he developed a way to reverse it, to actually not just slow it down, but to reverse many of his symptoms. And he was highly maligned by the medical profession at the time. They said, you can't go around telling people they can reverse this, because he did it with exercise. He did it with walking. And they said, you can't do that. So they made a public statement against him, and he was part of the Parkinson's Association in the area. In fact, he was president for a long time, then vice president. They ousted him from that organization. Before he passed away, he was 77 at the time, and he had written a book on it so that he could get that information out to people. And he contacted Norman Doidge, who wrote The Brain That Changes Itself. And we have his, he's got a couple books there on the side. You can take a look at it. He does tremendous writing. He's really good. But he wrote to him and he said, I'm 77. I really want people to know this before I die, that this is possible. There's a lot of people with Parkinson's. And so Norman Doidge, he said, can I come visit, well, actually, John Pepper said, can I come visit you in the United States? And Norman Doidge said, no, I'm coming there. And he went there and he investigated it. And he talked to his original doctor and his original specialist and why he had that diagnosis, because that's what the medical profession was saying. If he actually reversed it, then he didn't have Parkinson's. And they never once, these doctors that were maligning him, never once examined him or his records or talked to any of his doctors. They just said, obviously you didn't have it. You had the pseudo Parkinson's. So anyway, Norman Doidge went there and he investigated it, and he said, I mean, without a doubt, the gentleman had had Parkinson's since 38. And what he had done was two things that were absolutely remarkable. The first one was that he did use exercise, and it's no wonder, because exercise produces so many brain chemicals. It floods your brain with something called BDNF. BDNF is brain-derived neurotrophic factor. It's a long name, but really what it means is miracle grow for your brain. It floods it during exercise. There's so many things you can do following exercise that would be, something that you would learn easier, or a new skill. That's just one of them. There are probably 7 or 8 different ones that we know of that are produced during exercise. It is, if nothing else, a miracle drug in many, many ways. But that's what he used, was exercise. And then, interesting, Parkinson's is a lack of dopamine. And dopamine is a chemical that we use for movements, but dopamine is also a chemical that's needed for motivation. And so he had this low chemical for movement and motivation. And I don't know how he did it, except that he used his thinking brain to overcome his lack of motivation. So this was a really critical thing for this man, because then he intentionally started walking differently, talking differently, eating differently, because he was focusing on everything that he did. And if he didn't focus, then he reverted back to what he would be like with Parkinson's. But unless you knew that ahead of time, you wouldn't be able to recognize that he still had Parkinson's, because he did. And it still became progressive through his lifetime, but much, much slower rate. And so yes, the remarkable thing is for him also taking the thinking brain and overcoming this lack of motivation. because then as he exercised, that dopamine would pour into his system, and then that also stimulates the motivation factor. So, yeah, remarkable gentleman. So we're going to talk a little bit about brain injury with stroke. And what happens with stroke is that we have an area of the brain that either has lack of oxygen or it has a blood vessel that has burst. So either one can cause a lack of flow to a certain area of the brain. And on this particular set of slides, I can tell that they're taken, first of all, with different amounts of contrast. So one may be a contrast study and one may be an uncontrasted study, meaning we're giving IV or intravenous contrast during the procedure. But they're probably the same person taken on the same day. And usually a stroke will damage an area that is shaped a little bit like a triangle because the main vessel might be in this region and going that direction, okay? In this one, I can tell that this is where the damage is because, again, the fluid is the dark area and the brain tissue is the white and gray area. And so this area of damaged brain tissue has kind of shrunken down, so it's very scarred in this area. What happens in stroke, though, also is that early on, just because you see like if this was just in the early pictures, sometimes we see something like this where the blood has flooded this whole area, but that's not where the damage is necessarily. And the damage, once the blood is absorbed, the damage may be this little area right in the middle. So all of those areas around it are swollen with the blood and things that are happening from that either bleed or that lack of oxygen. And what you are left with afterwards of functional brain tissue may be much, much greater than you originally thought. Okay, so the damage may be much more localized. But what also happens in stroke is that people get into this period of non-use during the early healing stages. And so that signals to the brain, well, non-use. Again, non-use of neurons means we're not needed, we're just gonna kind of die off, okay? So that's why early on it's still really good to realize in a case of a stroke that you may have far more function left there than you realize, and that you can take the surrounding tissue and get it to interact by movement and by use to stimulate the inside areas of this damaged area to continue to work. And it takes a lot of, again, persistence and motivation. So, because part of what goes on in a stroke is tremendous decrease in certain nerve chemicals that are associated with mood. And so you generally get someone who's extremely depressed, and that's a tough one. But again, ways that you can increase those brain chemicals. Here's another one. This is just a brain injury, This is brain trauma. It's a head injury, and what it's done usually it's not in pink on our radiology slides. I think they did that on the internet for effect. But usually that area would be flow that is outside the actual brain cavity, but it's compressing on the brain and it's moving that brain over to the side. And here's the ventricles on this side, but they're closed on that side because of the swelling. So no fluid there. Yeah. So again, I want to talk about Alzheimer's for just a second here, because one of the main concerns that I have, and many people in medicine have this, we just aren't all on the same page about how to deal with it, but one of the main concerns is that we are seeing a lower and lower age group that has a diagnosis of dementia. And in the years between 2016 and 2020, Blue Cross Blue Shield did a study of this, and they found that they were seeing a 400% increase in the rate of dementia in the 30 to 45-year-old age range. 30 to 45. The average age of Alzheimer's is now lowered to 49. So it's a huge, huge concern why we're seeing that and what we're going to do about it. So dementia, I have a couple people, and this is quite interesting. Dementia in our country is something that people don't want to talk about. It's very scary. We're always told, at least I've always heard, that there's nothing you can do about it. And that's why some of the work I'm doing is so fascinating, because I actually do not see that. I see people reversing it. The hardest part about dementia is when people keep it to themselves and hide it and don't get any help, because you have to have help to turn it around. You can't, it's very hard to do by yourself, although it can be done. One of the doctors who's doing Dr. Bredesen's work had a gentleman walk into her office, and he asked for help. He said he was having trouble. He was in his 70s and he was having a lot of trouble thinking. So they said, well, you're in the right place. We handle brain health here. And they tested him, and he tested in the Alzheimer's range. He had outright Alzheimer's. He had driven himself in there. He had looked her up on the internet somehow and got himself in there to ask for help. He didn't have any family with him. And so they did a program with them using all the different parts of the protocol that Dr. Bredesen uses. And in fact, this particular case study is in his book of 100 case studies that he showed reversal of dementia. This gentleman didn't have the Alzheimer's gene. He had vascular dementia, so he had decreased blood flow to his brain, and he had decreased oxygen to his brain. He had blocked vessels and or vessels that were at least partially blocked. So he was losing brain function because of this. So they got him on a nutrition program. They got him on an exercise program. They got him on a brain retraining program. And he just started doing all of it. They had a coach, who was following up on him. He was extremely motivated. He was, I don't know if I mentioned this, he was an engineering professor at the university there. And about 4 months into it, he said, I want to be retested. And they said, well, we don't retest until it's been 6 months, because it takes at least 6 months to see a change. And they didn't want him to be disappointed. But he insisted, so they retested him, and he tested normal. And so fascinating gentleman, but there are many cases like that. So this idea that it can't be done is completely being undone, fortunately. My mother was like this a couple years ago. And it was during COVID. My dad was in the hospital on a ventilator from COVID, and my mom, I was staying with her, and she had a lot of problems and didn't recognize it, wasn't interested in doing anything. And so she's a perfect example of somebody who was in denial, didn't want anyone to know, didn't want to do anything about it. And that type of person is very difficult. It's almost like the family has to embrace that person and just kind of go along with them and do it with them until the person wakes up and says, I'm having trouble with my brain. Do you think there are some things I should be doing? And that's how she was. It took probably 18 months for her to get to that point. And now she's 82. She goes to the gym 3 times a week. She walks on the treadmill and does the exercise bike on the other days. She has online classes that she takes. She's learning to knit and crochet. And she just turned 82, and for her birthday, she got a piano, and she's taking lessons. So she's doing really, really well. But she is a perfect example of one of the people that they're hiding it, they don't want to know, they don't want to do anything about it. The motivation is not there. It comes from the group around them. So the building blocks, we're going to just finish up with a few things here. The things that it's going to take in order to give your brain the best chance of rewiring or making new brain cells. And it has to do with having the building blocks in terms of your diet, the whole foods, the foods that have the phytonutrients that we don't even know about yet, because there are hundreds and thousands of plant nutrients that we have yet to identify the reason for or the effect of them on our system. Our body takes that in, our body sorts it out, and our body uses them the way they need to be used. Sleep is critical. That's when your brain cleans itself. That's when your brain produces certain neurochemicals that are for brain health. Social is huge, and we underestimate it. In order to socialize in a group, you have to use so many parts of your brain. You have to use the memory, you have to use all your sensations, your sense of vision, your, it takes emotions, it takes everything in your brain to be interacting socially in a group. And that's why when we have people that are isolated, the rates of all forms of disease, but especially brain dysfunction, go way up. All-cause mortality is increased by social isolation. It's just so critical for brain health, and everything critical for brain health is critical for your body health. The two are absolutely connected. Exercise, I've mentioned several times here. These mainly because of the outpouring of so many things that are critical for your brain function, but all of those different chemicals produced during exercise, also for mood. Relaxation, I didn't put stress on here, I put relaxation because relaxation is what I want. And they did some studies with Alzheimer's patients, and they had them do the simplest of meditation. I don't remember what this meditation is called, but it's one where you're just sitting and you're first touching your forefinger to your thumb, and then your middle finger, and then your ring finger, and then your little finger. And I believe that there's a chant that goes with it. And they did a study, they did this for 10 minutes a day with elderly people that were struggling with dementia, and it increased executive function 10 minutes a day in these people. And they were not meditators, and this was not, any kind of complicated meditation. And then again, playing an instrument or anything actually, this is just one side of it, anything actually that involves your body and your brain, where you're listening, you're seeing, you're hearing, you're remembering things, when it involves all those various connections, that is going to be something that's really going to help improve brain function overall, all of the different aspects of brain function. So brain food, we just went over it a little bit. The fatty acids are in the middle here, but you can get fatty acids if you're not a meat eater or a fish eater. You can get them from algae. That's where the fish get the fatty acids. They weren't born with them. They get them from algae. And then, of course, the vegetables. I'm a big person for whole foods. So fruits and vegetables, absolutely, in their main natural form rather than a processed form. The healthy oils, the olive oil, the oils from fish, but also the avocado oils and the oils from nuts and seeds, really, really good for your brain. Blueberries have pterostilbene, which is also really nice for your brain. So all of these things. Exercise, I won't go over it again. It's my favorite though. And relaxation. And then the sleep we talked about. When you are asleep, your brain has this process called the glymphatic process, and it's a deep cleaning of the brain. And when you are in deep sleep, that's when it occurs. And when it occurs, this is what actually, what actually happens in the brain is that the brain tissue contracts down. It increases the fluid in the brain cavity, in the skull, and it allows this process of cleaning, deep cleaning for the brain. So sleep, critical for brain, and also critical for mood. That's when many of the mood chemicals are produced are during deep sleep and different phases of sleep. We talked about brain training, but really brain training can look like a lot of different things. And in some of the people with Alzheimer's, we actually put them on a really structured program of brain training, but it also needs to be a body and a brain movement that's going on, or a body and a brain type of activity is going to be one of your best kinds of brain retraining. But there are some programs on the internet. Brain HQ is one that's often used to do brain training. Again, the body-brain connection. These people are doing Tai Chi, but it's the same thing. They're using their balance centers. They're using their body awareness. They're using their senses for what's around them and what they see. They're following instructions. Lots of things going on in those brains and all the connections there. But this is social connection, just like what I was talking about before. Most of the pictures I saw of this gentleman with his son and grandson, he had a very flat face. There was no smile. When he was sitting with them like this, his whole demeanor changed. And really, it takes a lot of different sensations, emotions, memories to be in this interaction with other people. And that's why it's so healthy. It's so healthy for the brain. And again, anything healthy for the brain is going to be healthy for the body. So these people are making a huge number of connections between their brain cells. And this is one I love. This woman is, again, interacting, dancing, listening, using her body, social. It's a social situation, and she's listening to the music. Just beautiful example of making multiple new brain connections. So in the end here, I'm going to just wrap this up. The brain is incredible. The brain is an incredible part of our body. It's so connected to what our body does, and it really is very malleable. And you know, we need to be more aware of that, especially if we were brought up in the era when we were told this wasn't possible. And because everything that we're doing is showing that all of those people who were so-called quacks were actually right, and they were right on target. And so what I really want to leave you with, though, is this idea that you are in control here. You can use your brain to do it in a persistent way, a planned way, to be really consistent with it, and to be repetitious. It's a challenge. It definitely is a challenge. But you are in charge. You are the user of your brain.